Dealing with allergies is tough, especially allergies to your beloved furry friends. I think I'm genuinely allergic to my dog a little bit, but I love him too much to let him go.
Of course. I never tell people to get rid of their pets as much as possible. I think that makes me a better doctor, really.
And throw in hidden allergies and the fact that you can't trust at-home tests, it's a minefield.
Food sensitivity testing, that, in my opinion, is a scam. All this test is telling you is what you're consuming. That's all it is.
That's why we need experts like Dr. Zachary Rubin on hand.
Go take a hike. We're unfortunately chronically online, chronically on our phones and tablets, but we need to spend more time outdoors and playing outside and getting our hands in dirt. You could even be more controversial and say, we don't need soap on our skin every day.
I'm Dr. Karan, and in this podcast, we cut through the BS of modern health advice and tackle the biggest issues in science and medicine. Zach is a pediatric allergist, and the advice he gives online is gold. But in this episode, he doesn't just offer up allergy advice. He's also a clinical immunologist, so he weighs in on whether human metapneumovirus really is a pandemic-level threat, and how worried should we be about bird flu.
Our pandemic response to COVID became highly politicized, and I don't know if we can come back from that to the point that people don't think masks work.
And as yet another wildfire takes hold near Los Angeles, he tackles the major health burden of these blazes, set to become more frequent with climate change. Lots to dig into. Enjoy. Zach, thank you so much for joining me on this conversation. And, this is what I love about social media. You follow really interesting, knowledgeable people online and you get the chance to connect with them. And I've had so much fun sharing and watching your videos on everything from daily hacks, allergy advice, immunology advice, pediatric advice. It's really great.
Yeah, thank you so much for having me. I've been following you for several years now, too, and it's really nice to be able to connect across the pond.
Yeah, no, absolutely. I feel that, in the modern age, allergies have become increasingly common, and a lot of people may be going about their normal lives and having, the odd sniffle, the odd blocked nose, and various other signs and symptoms, which they may not realize or they may not even attribute to an allergy. What are some of those things which could, make someone wake up and think, hang on, Dr. Rubin said this, and actually maybe I should get checked out for some sort of allergy?
Right. So your nose is so important for your overall health, more than what I think people realize, because your nasal passages is the way that you're supposed to breathe normally, right? We're natural nose breathers. When you're a baby, you are basically an obligate nose breather, meaning you really just don't breathe through your mouth at all. So if you have chronic congestion, you are more likely to have sleep problems. And we all know how important sleep is, right? If you're not able to sleep well, you can't function well at school or work. It's hard to concentrate. It affects your mood, behavior. Long-term, there's risks with high blood pressure, weight gain. So if you feel like you wake up in the morning and you're like, I'm not really that refreshed, right? I'm really tired all the time. Fatigue may be related to rhinitis, as an example. Headaches, same thing. If you are having pressure in your face, especially on your forehead or in your cheeks, and it's this dull pain that's there constantly, you may have a sinus problem that could be related to untreated allergies, right? So the nasal cavities are connected to these air pockets in your skull that are called sinuses, and there's these little tiny openings called ostia that if around there's inflammation, it's going to close it up. And then the fluid that's in the sinuses will just kind of slowly build up and create pressure. So that facial pain and pressure that you experience that you may attribute as headaches, you may think, it's stress or lack of sleep, could be related to allergies as well. You could also have ear pain. The ear pain could be related to fluid that is building up because the inflammation is starting to close off those eustachian tubes in the back. That is what's draining in the middle ear as well. Itching is something that could be related to allergy that we don't always think about. So those are a few examples. And then one more I want to mention, which is very common that people don't always think about, is you're eating fruits and vegetables and you think, this particular fruit makes me feel a little itchy in my mouth or tastes spicy. Well, that actually might be a pollen allergy. That's called oral allergy syndrome. It's where your immune system thinks the fresh fruit or vegetable is actually pollen because the protein structures have similar features. We call that cross-reactivity in immunology, where the immune system reacts to two different substances because they share a common protein structure. But if you cook, can, process, or freeze that fruit or vegetable, it'll break down the protein enough so that you
Interesting.
don't have that issue, and it's safe to consume. And this is probably the most common form of food allergies, is from a severe pollen allergy.
I think that last point is really interesting about this cross-reactivity between two foods which have a common denominator protein or some similar protein structure. And I guess that could be, I don't know, maybe not a very common risk, but a risk nonetheless for people to be aware of. For example, if someone is allergic to peanuts, which is a common allergy, there may be certain types of vegetables. Certainly, I'm thinking something in the legume family, which
Right.
could have some cross-reactivity because of some similar proteins, right?
Right. Yeah. And this is one of the fascinating parts of allergy and immunology, is looking at risk of reacting to certain foods and cross reactivity, or we also call it cross sensitization. So, and it's interesting you bring up peanut as an example, because recently in the United States, Chick-fil-A announced that their French fries they changed the recipe of their French fries so that they added pea starch to it.
Okay.
And so people with a peanut allergy, there's a small percentage of them also reacting to peas. And so for years, people like myself would say, well, peanut oil is safe to consume for most people who are allergic to peanuts because they extract all of the protein out. So even it says peanut oil by name, there's really no peanut protein in it when it's extracted properly. So usually a place like Chick-fil-A is safe. But now that you add pea starch to it, there's somewhere around probably 5% of peanut allergic individuals who will also react to pea protein or lentils, these different legumes, because peanut is a legume versus tree nuts. There is some similarities there, but it's not as much. And so I worry on social media because I see people making posts saying, well, I reacted to this food and to this other food that I was not aware about. You shouldn't eat those as well. And that creates a lot of unnecessary fear, because there is a difference between cross reactivity and cross sensitization and actually being allergic to the food. So you could do a skin test and try to find the presence of the allergy antibodies to these different foods. And as an example, with peanut and peas, there's actually a high level, about roughly 30 to 50% of people on skin testing. If you test them for pea protein and they're peanut allergic, it'll say you're positive. But if you actually have them eat the pea protein, they're not always allergic. This goes to the pitfalls of allergy testing, which is that a positive test on a blood test or a skin test for a food allergen may not be clinically relevant, but may actually cause people to unnecessarily avoid foods. So you have to be careful about how you test people for food allergy.
Yeah, I mean, some of these over-the-counter food allergy intolerance tests you get, I've always been highly skeptical of them because presumably, one, from a manufacturing safety point of view, it makes sense for them to lower their risk significantly by telling someone that they'll be intolerant or allergic to more than they actually are. And
Right.
secondly, from a immunological point of view, they're using the wrong antibody test to test for a true allergy, right? I mean, if someone
Right.
was to eat a block of cheese and then did the allergy test will probably pick up the fact that this person ate some cheese and then flag it up as a intolerance or allergy, which is not right.
Yeah. So let me clarify that, because for people who are listening who may not be aware of this, so there are different types of tests that you can get at home from different companies. There's the traditional allergy test that you would get in an allergist's office that's measuring for the presence of IgE antibody, immunoglobulin E, and that's the one that could potentially cause life-threatening situations like anaphylaxis and you need an EpiPen for. But then there's also food sensitivity testing. That's where they're measuring a different antibody called IgG. And that, in my opinion, is a scam, because your immune system, every time you eat, has to determine, is this something that we're supposed to tolerate to keep us alive, or is this a parasite, a foreign invader?
Yeah.
It has to differentiate that. And one of the ways that it does that is your immune system creates IgG antibodies that are tolerance antibodies. It's basically telling the immune system, hey, guys, chill out, calm down. It's okay. This can pass through. That's okay. Versus it's not going to make those antibodies for a parasite or a virus or a bacteria in terms of that subclass of antibody. So if you were to take that test, and I see this on a regular basis, where they'll come to me and they show me a packet of 90, 100, 180 different foods, and it'll say, well, I'm sensitive to coffee. And then I'll ask them, do you drink coffee on a regular basis? Yeah, why? Well, all this test is telling you is what you're consuming. That's all it is.
Yeah.
And that is not helpful for people. Now, you will also get people on social media saying, I took this test, I took out some of these foods, and I felt better. And that's an anecdote that, in my opinion, usually refers to when people change their diet around, they're getting rid of something that probably they shouldn't be eating anyways, that's probably relatively unhealthy for them. And so they're going to feel better just because they changed their diet, not because of the particular test
Agreed.
showcasing that they're sensitive to something. We don't even know what food sensitivity really means from a scientific perspective. That's one thing that I want people to understand when they think about their health is physicians look at what is going on in the body under the surface. We're always looking at the root causes. We're always looking at what we call the pathophysiology, the underlying mechanism of the disease. We can create treatments and diagnostic tools by understanding that pathophysiology. But when you have a non-specific term like food sensitivity, what part of the immune system or the gastrointestinal system is leading to XYZ symptoms that people are attributing to food? That's really difficult. There's probably something there, but we don't understand that yet. So it's hard to give guidance, but there's going to be people out there selling unproven tests and treatments and supplements to fill that void and act confident to say, oh, you take the supplement, you're going to feel so much better. But where's the science and the underlying mechanism to figure that out? We don't have that.
Yeah, I agree. I think some of these unscrupulous food sensitivity tests, they essentially fearmonger and play to people's anxieties and fears. And once they tell these people, maybe superfluously or overzealously, you should cut out all of these things which you've been eating, and then they go on this restrictive diet, which arguably could lead to disordered eating habits. Then they find they restrict X, Y, and Z, like you said, which may have other things which could be causing problems, fructans, causing GI issues, potentially
Right.
wheat allergies or intolerances. And then they find that they may be symptomatically better, but then ultimately they haven't got to the root of the problem, which is, like you're saying, what we're trying to figure out. They've just excluded a entire cohort of foods. Now, on the other hand, someone who doesn't do these tests, you've also seen an uptick in the number of people doing oral food allergy challenges. So, they'll just try to figure out what they're allergic to based on some process of elimination, which in my eyes, as someone who's not an expert on allergies or immunology, seems a little bit, cavalier to be doing some allergy testing at home. What are your thoughts around that, and how can someone minimize the risk behind doing that? And is that okay to some degree?
Right. So you'll see videos online of people saying, hey, look at me trying this food out. It's hard to know what the underlying story is, but it always catches people's eyes when they think they're going to see somebody react and have, potentially severe hives, swelling, or, going to the emergency room, unfortunately. But if you go to an allergist and they do a proper risk assessment, I do have situations where, especially with my adult patients, I may tell them, you have a negative skin test on this particular food. We did a blood test. There's no appreciable antibody present. This is something where it's a low risk food. You probably can do this at home, because the unfortunate reality of this, and I don't know how allergists function in the UK with the universal healthcare system, but here in the United States, health insurance runs everything, all these different companies. So when I do an oral food challenge in my clinic, where I'm actually having them do it under strict medical supervision, and we spend 4 to 5 hours doing this scientifically, the insurance companies don't really reimburse this, and there's very little time to be able to get this done. We have to take up a room. I have to have a nurse working one-on-one with them. It's a lot of resources to do something like this, and we do this really as a service for our community. Not every allergist is able to afford to do this, unfortunately. That's the safest way to do it, unless you have an allergist saying, hey, this is how you can do it. You know the risks and the benefits. If you're ever concerned about a particular food causing problems, you really need to talk to a doctor about it, rather than going on social media and filming yourself or doing this on your own, because it does carry risks. And anaphylaxis, if you've ever seen it, could be quite scary. It is very difficult to see a loved one go through that. And we try to reduce that and eliminate those risks as much as possible, which is why we're seeing so many more treatments now becoming available for food allergy, and a lot more research with some promise now.
So, Zach, I mean, this next thing will be highly relevant to a lot of people because, like myself, they own, their furry best friend, cats, dogs, whatever.
Yeah.
And a lot of people do have some degree of severe or low grade baseline allergy to their animals, whether it's, I don't know, the saliva, the pet hair, whatever it is. It seems to be pretty common. I mean, I think I'm genuinely allergic to my dog a little bit because I sneeze probably at least once a day. All right. It's not excessive, but I sneeze once a day when I'm with my dog.
Yeah.
If I'm traveling for a conference or I'm on holiday somewhere, I'm completely fine. So, I think
Right.
he's doing something to me, but I love him too much to let him go.
Of course.
First of all, why do we get pet allergies? Like, what's going on?
Yeah. So with cats and dogs being the most common pets, most of what we're allergic to is a protein found in their saliva. And it could also be found on their skin cells or even their urine. Why we get allergy in general is, the age-old billion-dollar question: what is the exact trigger for it? I mean, we have a basic understanding of sensitization where, you have antigen-presenting cells grabbing the allergen and showing it to the adaptive immune system. It becomes sensitized. The B cells make antibodies. So we know that part. But why that initial step happens is elusive. I will tell you, though, there's a phenomenon I've noticed in myself personally and a lot of my patients where you grew up with an animal. And we know that those who grow up with animals are less likely to be pet allergic. But what happens is if you were with that animal for a while and then you go off to school, you go live somewhere else, or the pet unfortunately passes away, and you've got a period of time where you're not exposed to pets regularly, and then you get re-exposed, that's when the allergy often kicks off. So there's something to do with the fact that you may have developed these antibodies for whatever reason, and that regular low-level exposure has kept you relatively desensitized. Your immune system's kind of kept at bay. But then once that exposure goes away, and then you get re-exposed, that's when the problem happens. There are several different proteins that have been identified, and there's actually an international classification scheme that's a whole nother topic to talk about that's really actually fascinating in terms of how we identify these allergens and the nomenclature to all of this. But typically we think of pet allergens as being one or two different proteins that cause most of the disease for people. Again, it starts off in the saliva. Like for cats, they groom themselves and their saliva goes all over the place. The cat allergen protein is very light. It can stay in the air for several hours. It's also sticky. So even if you got rid of your cat and you're allergic, it takes several months before the levels go down. So it's really interesting when you think about the management of dog versus cat allergies. Dog allergies are much easier to manage than cats because unless you're bathing your cat once a week, it's very hard to reduce the amount of appreciable allergen in your home. There's only one newer treatment that's available for cat allergies, which Purina came out with this cat allergy food. I did my fellowship training in Washington University in St. Louis, and there were allergists who helped develop that food because Purina's headquarters is there. And they basically hyper-immunized chickens with the cat allergen so that they made this IgY neutralizing antibody that went through into their egg yolk, kind of similar to how humans have antibodies that go through placenta. And so the egg yolk has this neutralizing antibody to the cat allergen protein that they then sprinkle that onto the cat food. And when the cats eat the food daily for a month, it ends up neutralizing almost half of the allergenic protein there. I know you and I have made posts about this before because it's like one of the most fascinating kind of ways that we think about how to treat it. It's like a
biological vaccine, essentially. Like,
exactly.
You're feeding your cat antibodies from these kind of genetically modified, egg yolks or whatever.
Yeah, it's incredible. And I know there's a company that was trying to develop a similar technology through a vaccine called HypoCat, where they would actually immunize the cats to create this antibody, essentially, to block that protein or reduce the amount of protein. That's still under development. I'm not exactly sure where they're at with something like that. But we have that for cats. For dogs, it's easier to bathe a dog, and you got to bathe them regularly. I always tell people, keep your animals out of the bedroom. If you can do that, that's going to reduce a lot of your symptoms because when you go to sleep with your pet, you are constantly bombarding your immune system at the worst possible moment. One, you're stationary, right? because you're
Yeah.
sleeping. But two, your immune system operates differently at nighttime. And oftentimes that's why when you're sick, the nighttime is the worst because the immune system is operating differently. There's a circadian rhythm to it. It's the same thing with allergies. A lot of people will wake up and they're like, my mouth is so dry. Why is it dry? Because your nose is so congested from the allergies. Your mouth drops and you're breathing through your mouth, which you're not supposed to do. That dries out your gums. That can increase the risk of dental problems. And the dentist gets mad at me. I like to joke about, but so it's all connected that way. And so I never tell people to get rid of their pets as much as possible.
Yeah, I think that's wise.
I think that makes me a better doctor, really.
Oh yeah, absolutely.
We want to do whatever we can to keep them in the home. We may think of immunotherapy. There's shots and drops where you get regular tiny amounts of exposure to these allergens, and you slowly increase those doses over time. I only prescribe injections because they're typically a little bit more effective because you're giving higher doses closer to the immune system. But people may do drops out of convenience where they're taking a daily drop of the allergen every day. But either way, that's the only way to treat the underlying problem when it comes to pet allergies or environmental allergies, is to actually train your immune system to essentially become bored. It's the same kind of concept as children who are scared of scary movies, right? Initially, they don't want to see it, but then most of them, when they see scary movies over time, they become numb to it and they're like, okay, I'm used to this. It's the same type of concept. It's the regular exposure to it makes the difference.
I'm really fascinated with this idea of training the immune system, because obviously we have this growing appreciation now that one of the factors which trains our immune system is our microbiome, which we are beginning to learn more about.
Yeah.
And I guess if you look through the medical literature, most of the evidence points towards the fact that whether it's correlation or causation, it's difficult to tease apart right now, but there is a good body of evidence suggesting that those children who grew up in places, as you said earlier, maybe in rural, non-urban environments, exposed to animals, exposed to pets at an early age, have some degree of inoculation or potentially some positive shift in their microbiome, which then may have some knock-on effect on their immune system, which allows them to have a reduced risk of allergies to not only animals, like, the common dog or cat allergies, but also, reduced risk of food allergies like peanuts. And again, I've spoken to a lot of people, regarding this sort of microbiome research, and still the most plausible hypothesis they seem to come up with is not this kind of clean hypothesis, but the kind of familiar friends hypothesis, which is kind of shifted
friends,
from this, dirty is good. That's not true, but some degree of dirt or exposure to a normal lifestyle is okay. We don't need to be super sterilized. And I just wonder, from that point of view, could we even go one step further and recommend potentially, as doctors, as sort of health practitioners, if you have a child, consider from an early age exposing them to animals, going on trips to the countryside or forests from that early age when their microbiome is susceptible to be influenced in those first 600, 900 days, and expose them to these things. I'm not saying go and buy them a cat, dog, or whatever, or move to the countryside, but these things which are modifiable may be a huge game changer.
No, I totally agree with you that it's really about these kind of early microbial exposures that are harmless is really the key, because harmful bacteria and harmful viruses are not helpful. There's been a lot of confusion, especially since the COVID-19 pandemic, about the safety of viral illness, right?
Yeah.
That a lot of people will say, oh, COVID's not a big deal. Well, there was actually a study, and I believe it came out of either Scotland or somewhere near you, I think, or maybe Ireland, where they actually tracked kids, where they compared them pre-pandemic and in the beginning of the lockdowns, and they found that the kids who actually stayed at home were less likely to develop food allergy, and their microbiome composition was so different. And that's probably because they weren't getting infections, so they weren't needing antibiotics. Therefore, their gut microbiome was kept intact. So that's a really good study to show against the initial hygiene hypothesis of the ultra clean, and more thinking about what is your overall environment of these. Pets are one of them, but they carry a lot of harmless microbes too. But like you're mentioning, like go take a hike, like We're unfortunately chronically online, chronically on our phones and tablets, and staying indoors more so than we ever have been. But we need to spend more time outdoors and playing outside and getting our hands in dirt and less reliant on fragrances and you could even be more controversial and say we don't need soap on our skin every day, right?
A lot of celebrities have joined that movement.
Yeah, I mean, I will say that for my patients with eczema, I'm not a fan of using soap on their skin because it's already sensitive to begin with, and you're stripping away that natural barrier when you're using soap. So unless you see something visibly dirty, I often will tell my patients for their children, you may only need to use soap twice a week, but yes, you need to bathe in terms of sitting in a tub for 10 to 15 minutes to get that moisture back in. There's a little bit of a difference in that thought process. I just think we need to get a lot more research, and I'm hoping with quantum computing we'll be able to really get a better sense of the trillions of different data points to look at all these different bacteria that are in the gut to figure out there is something there, I believe, but the problem is that people are selling probiotics willy-nilly, so to speak, and we have no idea what type of probiotic you really need at what dose, the timing and the frequency to really make a truly impactful medical intervention. There are other avenues that we can also intervene in terms of, allergic diseases. One of my personal theories is there is a monoclonal antibody. It's a protein that's created in the lab that can turn off tiny parts of the immune system. And we have this for various allergic diseases, for cancer, for autoimmune diseases. And there are a couple of different types. One that I know has been actively studied called omalizumab, where if you give that to young kids, will that stave off allergic diseases? So there's omalizumab, dupilumab as examples, where they're turning off either allergic inflammation or eosinophilic inflammation. If you do that at an early age, will that prevent the risk of developing something like food allergy or asthma? I think those are really interesting questions that we have a lot to work on to figure out those answers.
I think, you mentioned the points about this. We've gone from this hygiene hypothesis, from this ultra clean, sterile mindset to then the complete polar opposite, where we're thinking, we don't care about, these viruses which only affect people who are immunocompromised or the elderly, and it's just a cold, it's just a flu. And one thing, so we have got that sort of dichotomy where it's either one end or the other. There's no sort of middle ground, it seems, certainly on social media and the echo chambers you find on a lot of these social media platforms. And the next thing which I've seen rear its ugly head in the last couple of weeks is the HMPV, the human metapneumovirus, that seems to be making waves online, and for want of a better phrase, going viral online as well, and people talking about it being the next COVID. But simply put, why is it not?
It's not, because we've known about human metapneumovirus since the early 2000s. It's nothing new. The reason why COVID was so bad was because it was a new virus where we had no population immunity, that nobody had been exposed to it before. And it was a highly contagious virus that affects not just your upper respiratory system, but also your vasculature too. Human metapneumovirus is something that causes upper respiratory infections. It causes a flu-like illness that we know about, that we have a level of population immunity too, that people have been exposed to this time and time again. Over 10 years ago, I had viral respiratory panels coming up with human metapneumovirus. This is something that doctors are very familiar with. And I think a lot of media outlets and social media are capitalizing on this unfortunate kind of fear news cycle that we get into with all these viral illnesses, because COVID changed kind of how we talk about public health and infectious diseases. COVID was and is still a very nasty virus. It is. But outside of that, what I'm much more concerned about is H5N1 bird flu being, the next potential pandemic. I'm much more worried about that. And even then, that's still kind of on the lower risk end currently. That could cause a lot more problems than what human metapneumovirus could potentially do.
We talk a lot about these zoonotic diseases where, similar to sort of bird flu and SARS that we've seen in the past, where they've been in cattle, they've been in agriculture and in wild animals, and they somehow make the jump into humans because of human-animal contact. And then it becomes a potential serious issue across multiple countries or even the world, as we've seen with COVID. the average person won't be able to do much on a global scale to, I guess, reduce the risk of that beyond, being more considerate when taking antibiotics and, basic measures to protect themselves and then thus society. But in this kind of new age where we're seeing more and more of these viruses jump from one species to another, particularly in humans, that's what we're worried about. What can we do globally, and the powers that be, the health organizations, to reduce the risk of pandemic after pandemic, causing this huge blot in human history over the next few decades?
Right. Well, it takes a global effort to be able to fight these issues. I mean, we still have tuberculosis, which is killing more than anything, right? And we have not properly addressed that. Just like when we think about the COVID-19 pandemic, it takes a lot of power in terms of person hours, resources, funding, research. When we think about the COVID-19 pandemic, and there was this Operation Warp Speed, we spent tons of money and resources into creating a vaccine very quickly. We have the human ingenuity to really accomplish anything if we put our minds to it. I really believe that. But it takes time, it takes resources that we have to invest in surveillance, right? We have to identify these things early so that we could identify ways to intervene. And we need better public health campaigns to promote what are some of the best interventions we've ever invented in human history. Vaccines. There's so much misinformation about the potential harms of vaccines when we know that for the vast majority of people, they are overall safe interventions compared to the actual infection themselves. And so if we can find ways to globally partner with different countries to put resources into surveillance, into resources to create vaccination or other types of interventions, to share resources with countries. A pandemic is a global problem. If there is an outbreak in one country, because we are a global society in terms of economics and travel and trade, what happens in one country is going to affect the world potentially. And that's what happened with COVID, and that's what's happened with other viruses and other infectious diseases. It's not just in isolation. So we have to take a global humanitarian approach to be able to successfully stave off more and more of these emerging diseases that are coming in.
So compared to 20 years ago, and then if you compare the response of the global community with SARS and then COVID, do you think with our increased response and ability to form a coalition pretty quickly and unite on a sort of a global, health front, are we prepared if bird flu became a pandemic within the next year?
That is such a hard question to answer. I don't know if I'm going to have the right answer to this, but I'm a little bit skeptical because I think one of the things that's really bothered me over the last few years is I felt that our pandemic response to COVID became highly politicized. And I don't know if we can come back from that anytime soon, to the point that people don't think masks work when they absolutely do work. I mean, as a surgeon, you wear a mask all the time, right? In the operating room, you've been doing that your whole career.
Yeah.
Right?
Yeah.
I mean, we do that when there's certain infectious diseases prior to COVID. We don't get sick. Like I go on a plane, I wear a mask all the time. I never get sick when I travel. They really do work if you use them properly. That's the problem. I think a lot of people just never used it correctly. And that's really frustrated me because I know you spent a lot of time too on social media trying to educate during the height of the pandemic too. And we really we put our patients and the broader community, not just at home, but abroad in mind when we really wanted to help people understand why these interventions are important. But I think politicians took that as an opportunity to, gain some political favor by spreading a lot of disinformation that has really confused a lot of people. And I hope we can come back from that. So, what we call an infodemic. I hope we can turn the tide with that.
One thing that I've been observing across the pond, it's the wildfires happening in California at the moment.
Yeah.
And I hope you and loved ones and family are safe. I guess a lot of the effects of the wildfires naturally will happen immediately, but also there'll be a delayed onset health effect negatively for these wildfires, whether it's coughing, shortness of breath, chest pains, rashes, problem with their vision potentially. Number one, I wanted to ask you, how can someone living in California right now who are unfortunately in the midst of these wildfires reduce their exposure?
Right. So I'm lucky that I'm in the suburbs of Chicago, so I'm not close to it myself. And I have relatives that are in the LA area, but far enough out that they're safe right now. So I'm very, very fortunate that my family's okay. My heart goes out to the millions of people that are affected by this. We actually had a similar issue a couple of summers ago in my area because in Canada, there were huge wildfires happening and there was a big plume of smoke that traveled south. So it's something that's becoming more and more common that people need to be aware of, that
Yeah.
the temperatures are becoming higher, drier, higher risks for these wildfires. And so we have to work on improving indoor air quality during all of this. So what you can do in the short term, if you're in that area, is to reduce the amount of time that you're spending outside. Keep your
Mhm.
windows and doors closed. You can try to seal up any cracks as much as possible. Wet towels or rags can be helpful if whatever you've got in front of you. If you have a HEPA air cleaner, a portable air purifier, that can be helpful. But if you don't have access to that, because they can be expensive, you could literally get a box fan and get one of those filters that you usually put in your furnace to attach to it. And there's different designs. They're often called the Corsi Rosenthal box, that you can put a setup of a triangle essentially to increase the efficiency of this kind of portable air filter to put throughout the house. And I would say that you need to have one specific room in the house that is the cleanest as possible, that you focus on and spend most of your time there. And you want to reduce the amount of energy that you're spending throughout the day. So if you have a gas stove, don't use it if there's any wildfire smoke, because gas stoves, they will release nitrogen dioxide and other noxious substances, volatile organic compounds, that will cause further inflammation. You want to reduce that as much as possible. If you are smoking or vaping, you should not be doing any of that during this time, because that's just going to
Yeah.
compound those risks as well. And when you're in your car, because if you've got to drive, make sure that you keep the windows closed, run the air in the car itself. Don't bring the outside air in, because you can just recirculate that air. And wear a high quality mask over your nose and mouth and have eye protection. When you come in, try to decontaminate as much as possible and rinse everything off so that you're not tracking all of those irritants throughout your home.
I guess it's in a weird way, but obviously on a completely different scale. It's similar to some types of exposure reducing measures you might take if you're suffering from hay fever, in a way, kind of reducing those contaminations and exposure to yourself and your eyes and ears and mouth to the soot and all this particulate matter outdoors. Now, I wanted to ask you, following on from that, say you have to go outside for whatever reason, you have been exposed to this fine particulate matter, and it's starting to cause some low-grade inflammation where you're chucking up more mucus, your nose are runny, your eyes are runny. What are some steps you can do from this point onwards to limit your symptoms going forwards?
Yeah, so I know it's not fun to do this, but if you can get access to some saline water, like get distilled water and mix it with salt solution, they even make packets, you can do it for you. But using like a neti pot or a saline rinse device, something to clean out your nasal cavity, doing that at least once, if not twice a day, will help remove the mucus that contains the irritants, the allergens, the potential chemicals you may be exposed to. It's very uncomfortable for many people, and I do it myself. Once you get used to it, it's not that bad, but that's really, really important. You also want to, as I mentioned before, not expend a lot of energy, because the more energy that you're spending, that's going to prime your immune system to be more reactive. And we see this with various allergic diseases. So if you have a food allergy, as an example, your risk for having a severe allergic reaction increases if you exercise. That elevated body temperature increases the immune response. So it's the same issue related to wildfire smoke. It's almost as if you're having kind of an allergic response that occurs when you're exposed to high amounts of fine
Yeah.
particulate matter. The immune system indiscriminately looks at all these different foreign substances and will have an exaggerated response if there's large amounts of them and you're exposed to them chronically. So you want to reduce that as much as possible. Humidifying your air, if you can, could also help relax and loosen up all of the debris that may be sitting in your lower airways, because eventually you have this mechanism called mucociliary clearance, where these little hair follicles are beating to a certain direction throughout your entire respiratory tract and taking that mucus and pushing it up and up and up to either cough it out or to swallow it. So having humidified air will help improve that mucociliary clearance process. If you're having dry air, those hair cells will not beat properly, and then all of that garbage will just get stuck in your lungs.
I think one thing which this whole situation and these events have really brought to light is the importance of air quality. And that is something I think a lot of people take for granted or ignore in their daily lives. And unfortunately, I have lived in a couple of places in my life where the air quality is pretty terrible. One being Mumbai, one being New Delhi.
Yeah.
What's really telling is the impact that air quality can have on someone's lifespan. It literally reduces lifespan by several years in those areas, the top 10 most polluted cities in the world. Going forward, this is one thing which maybe the average person doesn't have too much control over in terms of a modifiable risk factor in their lives. You kind of, you're born somewhere and you may decide to stay somewhere. And if you have the resources, you might, pack up and move somewhere with a better air quality. So overall, we mentioned a few things specific to the wildfires going on, but the average day-to-day person, for example, you're in Chicago, I'm living near London. We don't experience major crises with air quality on a daily basis. But what can we do to, make sure our air is as good as it can be so it doesn't have that detrimental impact on our health from day-to-day things we do, whether it's, indoor frankincense and candles, those kind of scented candles, people smoking around you, all those sort of things. What can we actually do?
Yeah, the number one issue is you should not be smoking or vaping. There's all this misinformation on social media about, well, vaping is really not that big of a deal. It's not as bad as cigarette smoking, and it's a gateway. It's really a gateway to all that high nicotine use that you get addicted to it. And I try to stress to people that no matter what, your immune system is everywhere, including your airways. And every time you take a breath in, it's going to look at whatever you bring into your body. So if it's a foreign particulate matter, the immune system will look at it and think it's a foreign invader and create an immune response. Chronically, any type of smoke exposure that you have will eventually lead to changes in your airways that could lead to scar tissue. And that's a major reason why people have shorter lifespans in areas where there's high pollution. Or, if you're smoking or vaping, you're at higher risk of having lung cancer because you're causing inflammation and damage. So every time you're doing that, your immune system is going to potentially cause cells in your lungs to break down, and then they're going to try to replicate. And every time you're regenerating cells, there's a risk of having abnormal proliferation of cells, and that's what cancer is. So that is the one modifiable risk factor that I will, yell at the rooftops. I will say over and over again, nobody should be smoking of any form, and that is including marijuana as an example too. Anything that is a smoke and inhalants, you really, our bodies have no business playing around with those things.
Yeah, no, agreed. I think, aside from someone needing nebulized medication or any inhaled medication, I really don't understand, similar to yourself, the argument for vaping. And I think sometimes it's like arguing into the void, because there are people who, not just the vaping lobbyists, but people who are very passionate about vaping, and they will fight to the death about the pros of vaping. But that's a subject for us for another day. But moving beyond that, some of the things you mentioned there to kind of clear the airways and clear your sinuses and nasal passages of some debris. You'd use that for the wildfires naturally, but also if you're suffering from any allergy, dust, whatever it is. You mentioned the neti pots and saline rinses. Now, we've seen so many videos online of people using these neti pots, and they look like a fun device that you can use for your child. There may be an easy way for your child to have their noses irrigated, and you get this big satisfying blob of snot coming out of someone's nose. But there are some real risks if that's not done properly, because these devices, someone can buy it online and just presumably assume they can just fill it up with water and then flush their noses with. But that's clearly has some degree of risk.
Yes, it's a small risk, but it's a risk that nobody should take, because the consequences can end your life, actually. So tap water, in rare instances, if you are to flush your nasal passages with it, could contain a parasite called Naegleria fowleri, and that's often referred to as brain-eating amoeba. And we get a couple
Scary.
cases in the United States each year from this. It's not necessarily from the rinses, but somebody's swimming in a pond or something like that. There's other ways you could be exposed to it, but this is one of these things where, yes, you may have to invest a little bit of money to get distilled water, or you have to spend time boiling tap water and letting it cool down. But you really don't want to take that risk, even if it's a tiny risk, because that's you don't want to play with your life with something like that. Also, if you're not cleaning out the devices based on the manufacturer guidelines, you could get biofilms of bacteria on there, and you're basically inoculating yourself with germs that you really don't want to have in there. So those are some of the major issues. And then also, if somebody has an underlying issue with the anatomy of their sinuses, like a deviated septum, or they had recent surgery, you got to be careful which type of device you choose, because some of them may not work, or they could be very painful. So always talk with your doctor if you're not sure which one's going to be the best type of device for you.
I guess that what you just said there, even though it's a rare risk, that risk remains, however small the percentage of something as seemingly innocuous as tap water going and affecting your brain. And that speaks to the close proximity of the nose, the sinuses, to the base of the brain. And all of these things are so close together. So when you are dealing with something like an allergy and you're inhaling a substance or putting something into your nose, I think it's worth just knowing that all of these structures are very close. And exactly like you said, you don't want to take any risk with something like that. Now, something I wanted to ask you, because this is something that you arguably see a lot of people doing wrong, especially when they have allergies, is using things like nasal sprays completely wrong. Now, I don't have a nasal spray with me, but I've got my AirPods case. And I wanted you to talk me through, and everyone else listening, the optimal technique for nasal spray usage, so people don't waste the nasal spray medication and get, bang for their buck.
Right. So we're going to pretend that that's your nasal spray right there. And so what I want people to understand is, you look at your outer nose and it looks like it's pointing towards the middle of your face, right? So a lot of people will naturally point the spray to the middle of their face, thinking that's where the nose goes. But in reality, you have something called the septum there that separates the nostrils, and you have two nasal cavities. And where you really want to get that inflammation down is actually towards your ears, because there's some important structures that are called the turbinates and the eustachian tube. That's the area that you really want to go. And so to get the optimal position, you want to look down. I say nose to toes is when you look down. And then you will place the nozzle. You can use your opposite hand for this, but you're going to place the nozzle slightly up your nostril, but then tilt it towards the opposite ear. So that will point towards your ear. And if it's a spray that you only do one spray, you're going to spray it once and then switch sides and go to the other side and spray again. And then you will look forward. And I typically tell people to breathe through their mouth and maybe gently sniff through their nose, but never never do that. Never snort it, because if you're snorting it, you're going to bring that medicine to the back of your throat, which means you're going to taste it. And if you taste it, you're wasting the medication. If you taste it, you waste it, is what I like to tell people. Also, it's going to taste nasty. Certain medications that are in a spray, like azolastine, that is an antihistamine nasal spray, which is often prescribed, but also now in the United States is over-counter as Astapro. It's very bitter. And so people often will gag on it if they're going to snort it.
Now, some of these nasal sprays, obviously, they contain medications, assuming they're not just saline sprays. And people who are suffering with, a stuffy nose and allergies often over-medicate themselves using these sprays. And, to some degree, they get addicted to them. And there's, this rhinitis medicamentosa, where they become so addicted to these sprays that actually they get this rebound effect when they stop using the sprays, and they become so stuffy, and they're almost essentially in this vicious cycle where they're hooked on that spray. And, the only options, some of the options are just to go cold turkey and last it out. So when someone has this rebound effect when they're taking a nasal spray that's medicated, number one, what can they do to avoid that? And number two, if they do end up having this rebound phenomenon where they get stuffiness because of excessive nasal spray usage, what can they do to break free?
Right. So it's really important to read the labels on medications that you get over the counter and understand what kind of spray you're using, because this is not true for every nasal spray. So what we're talking about specifically are nasal decongestant sprays. So that's going to be oxymetazoline or phenylephrine. Oral phenylephrine, by the way, doesn't work. I just got to make sure that we put that out there. Oral phenylephrine, it gets metabolized and broken down in the liver before it gets to your nose. So these common cough and cold remedies, I'm not sure what's happening in the UK about that. But in the United States, the FDA is likely going to remove a lot of these medications pretty soon. But the nasal spray version of phenylephrine and oxymetazoline, they really quickly clamp down on the blood vessels in your nasal passages so that it decongests your nose. You can breathe more easily. And people say, oh my gosh, I had it was cold. I took this spray. I feel like $1,000,000. If you do that for 3 days or more in a row, you're at risk for this rebound congestion. So if you limit the use of it, that'll help reduce the risk of this happening. There is some evidence in the literature that if you take an intranasal steroid like triamcinolone, fluticasone, this is like Flonase, Nasacort, Nasonex. I know in the UK, branded and unbranded. I'm going to make sure that's we're talking about for everybody. But these steroid sprays, if you take that with the decongestant, you might be able to get away with a little bit longer use. But I don't typically recommend that for most people. That is possible. And so minimizing the use will be helpful. But if you're stuck with this problem, you do have to get off of it. And really, cold turkey is one way that a lot of people do it, but you could talk with your doctor. One of the strategies could also be taking a short course of an oral corticosteroid like prednisone to decrease the inflammation that's occurring there. Or you could try to potentially wean off of it where you work on one nostril only and you still use it for the other nostril as you slowly work your way down. In very extreme conditions, you may need surgery for something like this if it's really, really bad congestion, but that's a last resort.
What are your thoughts on these things which have become quite popular now, which are nasal strips? And, obviously the science of nasal strips isn't particularly robust in terms of providing any, scientifically or physiologically backed support for allergies. How, beyond just increasing the size of the nostrils physically, just kind of splinting them open and allowing you to get more air inside and maybe reducing some resistance to airflow.
This is one of these types of interventions where on the surface, it seems like a low risk, potentially high reward where, okay, you might get a rash from the adhesive on your nose. It's not necessarily going to harm you in that short term. And if you're really struggling, especially with sleeping, it's good to try to improve your sleep. The problem is that that's not treating the underlying problem, which is inflammation inside your nasal cavities, such as with your turbinates. These are the ridges that help warm and humidify your air. And so untreated rhinitis alone has the risk of increasing for ear infections, sinus infections, right? And so those can significantly impact your quality of life and your ability to go to school, to go to work. And there can be some other potential complications as well. So I think of nasal strips as it's something you can certainly do in addition to these other things that you have to do that may include saline rinses, certain medications, identifying what you're sensitive to and reducing exposure to those, and potentially immunotherapy, which is usually in the form of shots or drops.
Thanks again to Dr. Zachary Rubin. What hacks have helped you deal with allergies or sinus issues? Share your secrets with me in the comments below. And make sure you subscribe so you don't miss the weekly Dr. Karan Explores podcast, and I'll see you sniffling sinus owners next week.